I have the privilege now to introduce Kim Bowman, who is the Director of Human Services in Chester County. She has worked at the provider, county, and state level in this field, and I have had the privilege for the entirety of my decade and a half that I have been in prevention to have her as one of my mentors, one of my guiding lights, and I am extremely grateful that she is one of the leaders in this field, and it is her passion and her vision that I aspire to bring into my own work. So without further ado, Kim Bowman, please join us.
Thank you, and I'm not confused at how lucky Chester County is to have Kathy. Although you would think I do her evaluation, I don't. She still says nice things. So when I thought about what I was going to say this morning about what we're doing, I thought, well, very simply and sort of concisely, it's really hard, and it's really worth it, and I could sit down. And then I thought, well, they know that. They might want something a little more substantive, but that is sort of what it is, but it is hard, and it is worth it. Well, I need to do a little bit of history to talk about how we got to, or how I got to where we are and what we're doing. I think it's important to sort of lay that groundwork, and also, as Tim sort of reminded me when I was coming in, old people like to tell stories, so you're going to have to hear them. I'm really sorry. It's what we do. So, as many of you know, I was in the drug and alcohol field for a very long time, several decades, and what became clear to me, I worked at the provider level, and I worked at the county level. It was very clear to me that prevention really was critical. If we were really going to make a difference and deal with this huge individual and family and community and economic and societal toll that addiction and drug and alcohol takes, we really needed to do a good job on the prevention end. And so at the county, we kind of looked at prevention, and as we looked to how to expand our prevention efforts and how do we get additional funding and additional support so that we can expand those efforts, and also so that we can have multiple legs under our funding stool, because it always is nice to have a little bit of stability if you lose a leg. We started to sort of feel like sometimes, and I'm sure some of you can relate, you had to be a bit of a contortionist to get these different funding sources, these different initiatives, these different efforts to work together in any kind of cohesive, comprehensive way. And it was that quite often it just was that they were disconnected. Everybody sort of had their priorities and their focus and their areas of issues. Sometimes it actually conflicted, or there was some antagonism. So you kind of figured out how to make it all work together because it was that important. Then I got the opportunity to go up to the state with the implementation of the Department of Drug and Alcohol programs. And one of the things that we really focused on was building a lot of partnerships. PCCD was one of the first ones because of all the tremendous work that they do around prevention. We knew we needed that partnership, and Department of Human Services, Bev Macrith, was there at the time around the children and youth, because we knew there was so many places where we coincided. Department of Health, which was where we were sort of born, so we had connections there, and the Department of Education. But we realized, and I liked the speaker earlier, the whole part about the strength of the individual members is the strength of the team, and the strength of the team is the strength of the individual members. It doesn't diminish the importance of any one discipline, but as a whole, we're just that much stronger, and we make each other stronger. So that became clearer and clearer to me, and the importance of working together. So we were able to start to do little things like help to fund the youth survey, because it made such a difference and gave such good information to all of us. So I left the state to come back to the county for the human service director role, and again just reinforce the importance of that cross systems and how we work together and how we strengthen each other, because the individuals, the families, the communities that we serve are not just one thing. You know, they bring a whole variety of strengths and challenges and resources and needs to the table. So how do we sort of leverage each other, and how do we sort of meld and braid the strengths that each of us brings to have a really strong tapestry and a really strong framework for how we support folks. So I was really lucky that through PCCD and Governor Wolf was appointed to the Pennsylvania Commission on Crime and Delinquency's Juvenile Justice Delinquency Prevention Committee. Woohoo! So you could say PCCCD, JJDCP, and leave everybody in mystery, right? And hope it all means the same thing in some other system. So, and in that, because had the opportunity and was really honored to be asked to sort of chair the reestablishment of a prevention subcommittee out of that committee, because I think PCCD has also always recognized the importance of prevention, and they have sort of the king of all prevention in Greg or Jeff sitting there in PCCD sort of helping to drive it all. So between sort of the strengths of DDAP and the strengths of PCCD and all the other systems, it started to really feel like we got some energy going and some cross-system stuff. So we started this prevention subcommittee. And a lot of really good state partners were there, Department of Drug and Alcohol, PCCD, community partners, community coalitions, and part of the discussion was around sustainability. And we started talking about, within PCCD, a lot of the prevention is really startup money. How do we get things started? And then the sustainability question comes up. And what does it look like in terms of the environment and the framework for sustainability? What are the resources out there? How successful are we at being able to financially sustain things? And maybe it would help to start to look at sort of the landscape and map out what are some of those resources, what are some of the opportunities to help ensure that the really good work that started is able to be sustained. And so that kind of thought, okay, well, let's start thinking about a more sort of broad-based statewide strategy. And out of that, we formed a little bit of a work group. And at the same time, PCCD, the committee, had done a sort of 5-year plan, and there had been discussions in the administration and in the governor's office about the real interest in developing a really strategic cross-systems sort of mapping and partnership around prevention so that we could look at where do we have things that can be leveraged, how does this good work get sustained, how do we take those evidence-informed, those evidence-based strategies and programs and policies and really make them scalable and sustainable, and what's PCCD's role in helping to lead and facilitate some of that, and where does this committee potentially fit in? So really exciting. We're starting to move, starting to do a whole lot of things. So what's happening here is this coalition is forming. We're not calling it that at this point. It's a work group. But as many of you know, there's a process. And it was really pretty exciting. And we had to go through all the same things that everybody else had to go through, that any coalition has to go through. So we had to decide what's our mission, what's our vision, and we spent time on that. What is it we're here for? What is it we're trying to do? We had to think about what's our area of focus. If we're thinking about it, are we looking at promotion, prevention? Where along the continuum are we going to sort of focus our energies? And what is it we're trying to prevent? Because remember, we're a JJDCB, right? Did I get that right, Jeff? It's a delinquency, it's out of PCC. So how do we connect all that? And so what is it? Is it delinquency? Is it substance use? Is there substance abuse? Is it depression and anxiety? And the discussions about the preventability of that got really interesting. But we had to have all those things, and we had to develop that. So we did. We got so that we really started to develop this cohesive group and move along. As those of you who do coalition work know, that's what you do. And we were really blessed because we had Department of Drug and Alcohol and leadership from there, and Department of Human Services, and Department of Ed at the table, and the Attorney General's office, and Department of Health, and PLCB, and community coalitions, and community prevention folks, and student assistance program, and county players. And so we really had a lot of energy, and we're moving right along, and we had this really wonderful work plan. And I was going to stand up here in June, today, and roll out the plan, because it was going to be just that great. Simple, straightforward, right? And then the heavy lifting started. So, and I have to say, I have to stop for a minute and really, Epicenter, sort of, we got them into this thinking short term, they can help facilitate a couple of work group sessions, great. It has taken on a life of its own, and the demands on their time, and I think Kathy had it wrong in discovering the 25th hour or the 26th. I think they've discovered 29 and 30 because they sort of pulled this onto their plate. So between Stephanie and Leanne and Phyllis, and they really helped to facilitate these meetings going forward, and we're moving. But then we started thinking about, then we started to have to really get into the details. And of course, saving kids is a great vision. We're going to create healthy youth. the devil's in the details. So what does that look like? So we started talking about, first, the program inventory. What's that funding look like? And how do we, sort of the thing that started all this, thought it'd be as simple as pushing a button in the state systems and a report would come out and, aha, we know what's happening, who's funding what, where, when, how, all of that good stuff. Not so much. So that's been a whole process with a subcommittee in and of itself, and many of you will hear about a survey coming out in the very near future to really get a handle around sort of what is out there, who's funding what, where do we have opportunities to leverage each other and leverage sort of the resources out there. We had to have the discussions about what does it mean. Are we trying to say you fund it, I don't? That's not what it's about. You know, we've had those discussions about, we're looking at how do we strengthen the system, how do we braid things, how do we weave things together to create the strongest fabric. So we need to have facts to do that. And people need to have facts upon which to make decisions. So that will be coming out. And then we said, okay, we've decided on what we're going to prevent. You know, we're looking at delinquency, and you have it in your little paper. This took a while. Our paper that sort of describes what we did, we had to create that. But we thought, let's focus on the things that we know we have the risk factors, all of those things around. So substance use, delinquency, school dropout, teen pregnancy, violence, depression and anxiety, sort of the new ones on the table. So let's take a focus on that, and let's make sure we're at the prevention end of the continuum. We're not going to really move too far into intervention or treatment. That's another issue. So then we said, okay, well, let's start to do, you know, the next thing you do is you sort of start to look at your data. So we looked at the tool that DDEP has developed, and it was really exciting because it's a really cool tool that was being piloted, and we thought this is great. It really puts it into a context, and it makes it easy, and it makes it logical, and let's give it a shot. And we did it, and it was great because we learned a whole lot, and it was really frustrating because we realized it was one piece of the puzzle for us, but it wasn't the whole thing. And, you know, they're still kind of working that one through. So, and Maureen was tremendous. She said, you can give it a shot, but remember, we're still working this through. But it really is a tremendous tool that's really exciting to see, having been sort of in the field for a while. But we realized we needed to go farther, because as we're looking at all these things, what are the constructs around delinquency? What are the constructs? What are the things that we need to look at? And again, thank the Lord for the EPIS and for Penn State. But we've stepped back to say, okay, we need to ground these in the research. So it's not, you know, we need to, what's the next step beyond the PAYS? We have the PAYS, we have all of that information, but now what do we do? What are the other indicators we want to look at around delinquency and around school dropout? And what's the research tell us? And how do we format that in a way that we can then actually work with as a coalition to make sense of it, to help us prioritize? So that's where we are at this point. And, you know, a couple of times had to kind of stop and say, wait a minute, if this were easy, it would have been done. If this was already sort of an established, Lord, here's the model, go for it, you know, go forth and apply, populate data fields, all that good stuff, we would do it. It doesn't. This is hard work, but it is so worth it, and it is so exciting, and keeping that momentum going is where we are, and really thinking about how do we do this so that we can have a framework that can help to identify current high-risk areas in the Commonwealth for people to be able to use to help inform decisions. We've had to remember we're just sort of like a work group and advisory. We're not like the czars of prevention, czarinas. So it's to help inform, but we're really looking to step back to say, okay, what does this look like? What are those constructs? And is there an existing tool, and how do we work with the epidemiology work group and all of those other folks to make sure we have the right data? You know, a lot of times it's easy to have a lot of data, but how do we have the right data, and how do we have it in a framework that's grounded, and Joshie, thank you, in research and all of those good things, to be able to paint the picture for people to use to inform decisions, and that can be updated and enhanced and grown and sort of refined over time to continue that process. And it is a process. So that's where we are. I'd love to tell you that, you know, you guys that do coalition work all the time know this. You know, it was like, for me, I realized it once in Chester County. We had an aha moment where we said, if we really want these coalitions to be successful, we have to apply a resource in terms of a mobilizer. You know, we had to step back at the state level, not the state at this group level and say, okay, we're trying to achieve something and maybe we have to think the same way. What's the resource there? So how's that working? So I think that's working and moving forward, but it really is exciting stuff. It's moving. I think it's going to be a really positive end result that's going to be beneficial across multiple systems, help bring some sort of unified language, some unified sort of way to look at data and risk factors and protective factors, and the other thing, how does trauma and all those other things fit into all of this, assets. So we're really working that through and taking the time to do that, which I think is important and deserved, because what we're doing is that important. So we're really lucky to have all the state partners there. DDAP has been tremendous. Again, Jeff, the king of all prevention, has truly been essential and a key leader in driving this and helping with that. So while it's hard, as you all know, it's important. And I'm really grateful to be part of it because, again, the value for prevention, being old and having been around a while, I am one of those people that see it on an individual level, because I get to see the 20-something that 20 years ago came into treatment with their mom and is now and got prevention services while mom was in treatment. And I know those. I still have contact, and I get to see this first generation of family not struggling with addiction. So I can see at the individual level how important it is. And I also see it at the system level, because I get so excited. I look at the pays, and I look at the drug and alcohol numbers, and I go, wow, we have lines going down. So when you think about, what are we doing? Now, we still got work. You look at some of the depression stuff, some of the suicide stuff, it's really scary. You look at some of the perceived risk, and we're going to have some heavy lifting to do around perceived risk and accessibility, as we're doing some things around medications, around medical marijuana. But being thoughtful about it and really thinking it through and planning for it is going to make it all the stronger, and it's going to make the response make a difference. So thank you for having me. Thank you for all the work that you do every day. Thank you to all the people that are participating and supporting this work group. It's been tremendous, and the work will continue. So thank you. And now I'm still standing here, not just because I like to hear you clap, but also because it's my pleasure now to introduce Jen Smith, the Secretary for the Department of Drug and Alcohol, an agency obviously near and dear to my heart, that I think really highly of. And Jen started, and they didn't give me anything, so I'm making it up.
Okay.
No, I read it. No. No, I think Jen's really impressive in terms of, and I did, she started in state government in her career over at the Office of Budget, and as you sort of read through what her career has looked like, it's been an increasingly responsible positions throughout that really do look to build on strengths and capacities and things that exist. And she started in the Office of Budget and continued to move up, eventually becoming the Bureau Director for Planning and Management. And it was all of the strengths, I think, that she demonstrated in those positions that led to her then being appointed as the Deputy Secretary for the Department of Drug and Alcohol Programs, where she did an excellent job, which leading to her then appointment as Secretary for the Department of Drug and Alcohol Programs. So I want to say one, thank you, because I think our group is really grateful for the leadership and the role of DDAP in prevention and the strength that you guys continually bring to the table, and for Maureen's participation and leadership in the work group has been really important. And then probably the one thing that I found in talking to Jen this morning that is hugely impressive to me is that she manages to do all that and still have 4 kids at home that she's raising. So Jen, thank you for what you do, and your turn. Thank you.
Okay, good morning. I feel a little bit of pressure because Jeff and Arlene really did such a good job with their thank you speeches. They had people in tears and standing ovations, and now I'm getting a little nervous that what I wrote probably isn't good enough for everyone. So the first comment I wanted to make is, wow. the number of people sitting in this room, even compared to last year, and I know my memory isn't all that great, but I do recall last year, and I was speaking again on the last day, and I think a lot of people were getting their luggage and checking out, and some people had already left, and so I didn't really get a full picture for how many attendees were there. I'll give you that. But this is a big group. You should be really proud of the fact that you all are coming to make this an important part of your work life. So, and for some of you, your personal life. So thank you for that. The other thing I'll say very quickly is that Dr. Rachael Levine, who is a colleague and a very good friend of mine, does send her regrets for not being able to stand up here next to me and give some of these remarks alongside me, but she will be speaking with you virtually in just a little while for the medical marijuana session. So she did send her regrets that she couldn't be here for the entire time. So I'll start by saying yet another thank you. I won't start crying, at least not yet anyway. But thank you to all of you for the work that you do every day to educate and to support Pennsylvanians. Because of what you do, Pennsylvanians of all ages have the tools to protect themselves from dangerous behaviors like substance misuse, and excessive gambling. This education allows them to pass what you teach to their families and loved ones, spreading the valuable, potentially life-saving information beyond your immediate resources. Our world is constantly evolving, and those constant changes bring new challenges that we have to adapt. The current prescription opioid and heroin crisis is not the first serious challenge that we faced, and unfortunately it will not be the last. However, I know that the work you do is helping to stem the impact of that crisis. The data we see related to the crisis is very troubling, and I know it can be discouraging to continually see increases in overdose deaths, even as we're putting our full effort behind addressing the epidemic, on top of all the necessary prevention and education activities going on throughout the state. But despite this, please know that your work is helping and it's protecting people. Your work equips Pennsylvanians with the tools they need to make healthy, proactive decisions. Your efforts are also building a line of defense against other dangerous behaviors, and whatever epidemic might come next, and there will be more. We are seeing an uptick in methamphetamines, as well as fentanyl being mixed into cocaine and other non-opioid drugs. We have to keep an eye on medical marijuana. As medical marijuana becomes more prevalent in Pennsylvania and other states begin to relax laws surrounding recreational use, it's more important than ever that people understand the risks of marijuana use when considering its potential benefits. And you all have been a strong advocate for educating individuals about those risks. It's likely that we're not going to see significant strides in the opioid epidemic for another couple of years, but we have to remain steadfast in our efforts to stop dangerous behaviors before they start, while also remembering that substance use disorder is not a moral failing, but a disease. We have the opportunity to use our prevention efforts to create an informed, empathetic public. How does that sound? An informed, empathetic public that does not engage in dangerous substance misuse, but supports individuals seeking treatment and living in recovery and their loved ones in order to break the stigma associated with the disease. By doing so, we can mitigate the risk of relapse for people who are seeking a happy, healthy life in recovery, a reality that really is possible for anyone. So before I start delving into some of the things that the state is doing, I wanted to give a quick shout out to CPA and the PA Stop campaign. So I attended a conference a couple weeks ago of all the state directors for drug and alcohol authorities. So all the people like me in the 50 states plus Guam. We all gather for our conference. We talk about lots of different things, from prevention areas to treatment areas, recovery supports. And I had a very unusual opportunity to meet one-on-one with the acting director for the Office of National Drug Control Policy, also referred to as ONDCP. His name is Jim Carroll, and he attended our conference and requested to speak individually with a handful of states. And he had some pretty specific questions that he wanted to talk through. And so Pennsylvania was lucky enough to be asked to be one of those people. I knew I had 30 minutes with him. I knew some of the things he was going to ask about, so I walked in with an agenda bulleted. It was prioritized. I had practiced being very concise so that I could get through everything I wanted to in 30 minutes. I didn't end up touching a single thing that was on my list, because if you've ever met Jim, he's a very enthusiastic man and kind of takes the conversation where he wants to take the conversation. And one of the questions he asked me in the room that I was not necessarily prepared for was, what's Pennsylvania doing in the prevention space, specifically for parents? Okay. And the first thing that came to mind was our PA Stop campaign and all the materials that we have available and the posters that we've distributed at rest stops. And so I talked to him for just a few minutes about that campaign because we didn't have a whole lot of time. And I said, but as soon as I get back to my room, I'm going to send you an email with a link to the website that has all the materials on it. You're going to see it's really great. You're going to love it. So I sent him that link, and within about 10 minutes of sending the email, he wrote back immediately and said, "This is fantastic work. Tell your people this is good stuff." So I wanted you all to hear that personally. You know, this is the acting director of ONDCP, who basically reports to Kellyanne Conway, who reports to the President of the United States. So that's a pretty big deal, folks. So I think we need a round of applause for CPA and all the people involved with PA Stop. Okay, so some of the things that our department and the administration as a whole are working on. In January of 2018, Governor Wolf declared the opioid epidemic a statewide disaster. That probably sounds a little bit bizarre. Most people are talking about it in terms of a public health crisis, not necessarily a disaster. The reason for that decision was in Pennsylvania, neither the governor nor the secretary for the Department of Health actually have the authority to declare a public health emergency. Kind of strange. We're working on that. So the governor's only option was to declare a disaster. And typically that kind of declaration is reserved for things like hurricanes, floods, tornadoes, natural disasters. So it was a little bit unique in how many other states are handling addressing the opioid epidemic, but for us it worked tremendously well. So what the disaster declaration allowed us to do was waive certain regulations that deemed to be burdensome for accessing treatment, for accessing naloxone, which is the life-saving overdose reversal drug. But even more importantly than those things, it forced a coordination between state agencies that you wouldn't have expected. So you heard Kim talking about how important it is to have relationships and to work together. And so there are many state agencies around this issue that work very closely. The Department of Health, the Department of Human Services, Department of Aging, PCCD. But it's just that handful that really have a regular interaction with each other. What this disaster declaration did was it forced agencies to have weekly, sometimes daily meetings together. And it brought in about 14 different agencies. So now we're talking with state police, the Department of Corrections, we've pulled in insurance. So all of these military affairs, all these entities that when you think of drug and alcohol issues, they don't necessarily rise to the forefront of your mind, but they have a really important part to play. So one tremendous benefit of that declaration was putting an emphasis on the coordination that's needed from a state perspective across all agencies. So the response to the declaration is managed at the Pennsylvania Emergency Management Agency, also referred to as PEMA, and it's staffed by PEMA and the Department of Health. So they have dedicated individuals who are managing all of the efforts around this disaster declaration. Part of the focus of this unified coordination group was to enhance data that's available to state agencies and to the public, and to look for more opportunities for real-time reporting that can better inform the administration's response to the epidemic. It also helps us identify areas where we see treatment gaps, potential hotspots for overdoses, and areas where we can eventually help inform prevention efforts. A disaster declaration lasts for 90 days, so it was declared in January. The governor did opt to renew that declaration in April in order to continue these unified efforts. So with that renewal, additional initiatives and projects were added to that extension, including, you're going to love this, a prevention-oriented initiative aimed at increasing the number of prescription drug take-back boxes in pharmacies across Pennsylvania. And in fact, I just did a press conference at a Rite Aid in Lemoyne last week to announce the first of 100 new boxes that will be placed in Rite Aid pharmacies across the state of Pennsylvania. So that's going to bring the count in Pennsylvania up over 100 boxes. And to give you a little bit of perspective on really how amazing that is, I was at a national conference last year, and one of the speakers in a workshop was bragging about the fact that their state had 40 take-back boxes. You know, this is just tremendous. We have 40 take-back boxes. And at that time, we had about 580. So I'm sitting in the audience like, do I burst her bubble or just sit here quietly? I did not burst her bubble. But this is really something to be proud of, folks. The number of take-back boxes that we have. I think some people get tired of talking about it. Don't get tired of talking about it. This really is an excellent prevention initiative and one that we really need to continue focusing on. So I applaud you for talking about your program in Bucks County and all the things that you're doing there, and I encourage all of you to continue keeping this as a focus in your respective counties. Also, as part of this extension of the declaration, DDAP staff is doing some outreach to pharmacists to educate them about the benefits of providing those safe take-back opportunities. We're going to continue expanding our messaging and outreach to the general public to educate them on disposing of old, unwanted, unneeded, or expired medications, and hopefully make their homes safer. Beyond just looking for more avenues for data collection, we're also looking at better ways to make use of data, including presenting it to the public in a more digestible manner. Pennsylvania was a little bit slow on the uptick when we started to really see the overdose deaths, and we knew that we were really headed into this full-on epidemic. A lot of other states started publishing data on their websites about overdoses, naloxone saves, things like that. Pennsylvania was a little bit slow to the table getting there. But when we jump in, we make a big splash. So we released in March the opioid data dashboard. It can be found at www.pa.gov/opioids. And the dashboard really helps tell the story of the opioid and heroin epidemic through the lenses of prevention, treatment, and rescue. Currently, the prevention section highlights progress made by Pennsylvania's prescription drug monitoring program and opioid stewardship initiatives like prescribing guidelines, enhanced medical student education, and provider training. Staff from DDAP, the Department of Health, the Department of Human Services, as well as other agencies, continue to work on expanding the things that are in that dashboard. So what you see out there now is what we're calling phase 1 of the dashboard, and there is a whole phase 2 that's going to be coming within the next year. But based on what we have out there on phase 1, we've already been contacted by the federal government to have more specific conversations about the information and the layout of that dashboard, because they're looking to create a national dashboard model for all states to use, and they're considering Pennsylvania as one of those national models. So again, here we are, folks, Pennsylvania at the forefront. We might have been a little slow getting there, but we really made an impression when we did. So through a grant from the Aetna Foundation, we'll be partnering with the University of Pittsburgh's Graduate School of Public Health to implement that phase 2 of the dashboard. We also have data dashboards that were developed under the Strategic Prevention Framework Partnerships for Success grant. And those dashboards you can find by going to our department's website and clicking on the data dashboard link. And they were intended to assist in prevention needs assessment efforts. They contain county and state data for alcohol, tobacco, and other drugs, as well as gambling. The dashboards include data from the PA Youth Survey, or PAYS, as well as data such as drug and alcohol-related arrests and crashes, census data, and problem gambling helpline call data. In other news, other things that the state's working on, you might have heard about this little tiny grant that Pennsylvania received through the 21st Century Cures Act. This was an act passed in December of 2016 by former President Obama. The entire amount of allocation was $1 billion to be allocated to the 50 states over a 2-year period, and the allocation was based on a formula. In this case, although it wasn't great to be at the top of the list because that meant things were really bad for you, it also meant you got a whole lot more money, and Pennsylvania was 4th highest on the list in terms of the amounts of money. So we were eligible for $26.5 million each year for 2 years. Now, the catch with that money was that it was primarily to be used on treatment, and there was to be a focus on medication-assisted treatment. So for all of you prevention people in the room, that's a big womp womp. So there was a little bit of money that we were permitted to use for prevention activities. So there was an allocation to your single county authorities for a little bit of money that was used for student assistance programming. The exciting news, however, for year 2 of that allocation, which we just received in May, is that the cap on what we could spend on prevention was lifted. Ah! Yes! So, what I'm going to encourage you today to do, now if I have any SCAs in the room, plug your ears a little bit. I'm going to encourage you to have some very serious conversations with your single county authorities and others at the county level that make these decisions, to look at the planning that you had done when you originally were thinking about how to spend this money. So the single county authority is responsible for spending the allocation that came for treatment purposes and the little bit that came for prevention. So now that in year 2 that cap is lifted, I know that many of you had done planning assuming you were getting 2 years worth, and so it may be difficult to adjust some of those plans because they may have already somewhat spent the money in terms of using it for prevention. But I would encourage you to have that conversation, because if there's money available, if there's a way to change those plans, if there's a way to utilize other funding streams for some of those treatment initiatives and instead use the cures funding to address some prevention issues, there's plenty of time to do that. So the money technically has to be spent by April 30th of next year. However, the federal government has assured us that they will give us carryovers and no-cost extensions. So there will be an opportunity to spend it beyond that. You cannot count it as sustained funding, however. It was a 2-year grant, and it is done after that 2-year grant. But I have more good news. Even though there is no more Cures Act funding, there was, in the upcoming fiscal year for the federal government, another $1 billion worth of appropriation dedicated to addressing the opioid crisis. So now instead of $1 billion being spread over 2 years, it's $1 billion in 1 year. Now, we have not been told from the federal government what that allocation method will be. So I don't know if we can expect the same kind of $52 million coming to Pennsylvania. That's a lot of money in 1 year, people. I don't know if we can expect that or not, but we can be assured it's going to be a hefty sum of money to spend in 1 year. So I think it would be a really wise idea if you start having some conversations now about how you might be able to utilize that money. To my knowledge, there has not been a cap placed on whether it's treatment, prevention, MAT, non-MAT, those kind of specifics haven't been given out to us yet. So I think it would be wise for all of you to have a plan in place so that once the money hits the ground, you know exactly what you want to be able to spend it on, and you can adjust those priorities if there are any caveats given about how to spend the money. So see, I gave you 2 good newses today. Some of the things, just for your information, some of the things we've done with that Cures Act funding, we funded PACMAT centers, which stands for Pennsylvania Coordinated Medication-Assisted Treatment. It's a hub-and-spoke model that was designed to expand access to medication-assisted treatment through primary care physicians. We did some work around the prescription drug monitoring program and enhancing its interaction with electronic health records across the state. We spent some money training the field on motivational interviewing, cognitive behavioral therapy. We allocated about $12 million of it out to the single county authorities for use at the local programming level. And with the second year of funding, a lot of what we're doing is continuing many of those efforts. So there will be some more PACMAT centers announced. We're also going to put a focus on some priority populations like pregnant women and women with children, and expanding capacity and access to services, whether it's treatment services or recovery support services. And hopefully we can lump some prevention in there too. Just don't tell the federal government. And then also focusing still on funding for under or uninsured Pennsylvanians who are seeking treatment services. One last thing I want to mention. How am I doing with time, Debbie? Oh, good. Okay. I want to give a special thank you to the folks from my department who are sitting here. They are by nature individuals who don't like to be in the limelight. They enjoy sitting back and letting everyone else take the glory for everything. They don't like to be the loud ones in the meeting, but they do really important and incredible work. And so they deserve a round of applause today for the efforts that they have done. So they've been working recently very closely with the Epicenter. I sense a trend around here, working with the Epicenter. Sounds like they need more staff and probably more funding. But they've been working with them to to develop a prevention needs assessment and planning process for SCAs. The other thing they've been working on is the implementation of a brand new prevention data system, which has taken up an awful lot of their time. So thanks to all of you who helped provide input to that needs assessment process. Also, special thank you to Bucks, Dauphin, Armstrong, Indiana Clarion, and Washington single county authorities, as well as their providers and partners who are participating in the pilot of that process. And we're looking forward to rolling it out to all SCAs this fall. We really do hope that it's going to improve data-driven prevention planning throughout the state. And in conjunction with the new data system that we'll have, we're just going to be brand spanking new and have all this great planning tools and data and processes. So to Kim's point about how important it is to really gather the data and look at the facts and look at what the data is telling us to do. We recognize that very much at the state level. And that's why there are a lot of these initiatives that seem to be coming at the wrong time. You know, why would you, in the middle of a crisis like this, stop to implement new data systems? That seems ludicrous. But it's really not ludicrous, because those things are what help drive policy decisions. Those things are what's going to help save lives, ultimately. So, in conclusion, on behalf of Governor Wolf and Dr. Rachael Levine, my colleagues, and myself, I thank you again for all the things you do every day to serve the Commonwealth of Pennsylvania. Your efforts are helping Pennsylvanians make decisions to protect their health and well-being and ultimately save their lives. Thank you.